Good morning, folks. We're going to give a couple more minutes before we get started. Vanessa, if you can let me know when everybody's kind of been admitted and we can start the call.
Will do. Director, the numbers seem to be holding about steady at this point.
Okay, thank you. Well, good afternoon, everybody, and welcome to the Thursday, August 15th monthly briefing call with our local partners. Couple of things directly from my desk here to just throw out there. We do have a request into FEMA for a declaration request for July 10th to July 13th, and that is still pending. And then we also have been informed that FEMA is operating under immediate needs funding as of August 7th. So I'll ask Austin to just speak on that underneath his section report here a little bit about that. But those are the two things really from my desk here this afternoon, just to kind of get on your radar screen. Going to go directly into section chief briefings because we do have a presentation at the end of the call. So we can go to the rep program, Dave Valancourt.
Good afternoon, everyone. A couple updates from REP. Just a reminder, we have a few open slots for our radar officer training on September 17th. And you can sign up on our resource center for that. Our Seabrook Summit will be September 18th. It'll be 6 to 8 p.m. at the Incident Field Office in Portsmouth. And just letting everyone know some upcoming drills and exercise for REP. Our MS1, which is our Wentworth Douglas Hospital exercise, showing we are able to transport patients from the hospital, is September 25th. And our out of sequence exercises, just a reminder that we'll be doing those for our schools, daycares, nursing homes, and day camps, October 7, 8, 9, 10, and 11. That's what I have for Rep Director.
Thank you, Dave. Bob Christensen, Training, Exercise, and Development.
Good afternoon, everyone. Just a few things. We're going to be doing a upcoming drill at Concord Hospital, Concord Hospital, Laconia, following Franklin. I bring that up because, again, those drills, and you've heard me emphasize drills are an excellent way to validate plans. So if you've got medical facilities in your municipality, it's a great thing to begin to plan and talk about. We do have HSEEP, Homeland Security Exercise and Evaluation Program training coming up on September 3 and 4 here in Concord. That can be signed up on the Resource Center, as was just mentioned by Dave, as well as all the other training, such as we have 3 emergency preparedness for faith-based community organizations coming up. North Conway on September 18, Manchester October 1, Laconia October 19. And particularly that Laconia one, we can certainly use a lot more registrants for that Laconia one. Again, all on the the Resource Center. 2 final things is that on December 9 through 13, that was a reschedule to that date for our N0305 Type 3 IMAT training. It's a 5-day training with a number of prerequisites. So if you're interested, certainly reach out to me, which brings me to my last point. We unfortunately lost Rich Cloutier to Health and Human Services. Good for him. He's moved on into a significant promotion. But so if you're needing to get anything reference training and exercises, please go ahead and feel free to reach out to me. My mobile number being 491-2079. Again, 491-2079. Or as always, you can call HSCM's main line to reach me. Thank you very much, Director. That is it.
Thank you, Bob. Austin Brown, Austin Mitigation Recovery.
Good afternoon, everyone. As the director alluded to, a whole host of things going on in the mitigation recovery section, starting first with immediate needs funding, just to give some more information there. INF prioritizes funding for ongoing disasters, critical needs, while also ensuring FEMA is continually ready to respond to new disasters that occur. It's important to note this posture doesn't cancel any work for other projects or really anything that is currently in the queue. So again, we're really wanting to highlight the fact that we're going to continue to be working with communities on their projects and continue to be making sure that they're moving through the process. Work during INF will continue right up to the point of obligation. And once INF is lifted, FEMA will work to obligate those projects as quickly as possible. And again, of note, that's relative to the public assistance side of the house. INF also does impact the mitigation side of the house as well. And we're working to identify and coordinate with those communities that are specifically impacted. Again, really the main emphasis is on projects that have not yet been obligated, really is the main focus there. Outside of INF, highlight that the request for public assistance for DR 4799, that's the April nor'easter disaster. The application deadline for those specifically for Grafton County is still open. So if you're in Grafton County and have damages or looking to pursue public assistance relative to DR 4799, you have until August 20th to submit your request for that. Once I'm done briefing out, I'll put a link to where you can find that link on our resource center. Also, we'll be sending out some information later today relative to FEMA Swift Current. It's a new subsidiary program that's been really started over the last handful of years, subsidiary program to the Flood Mitigation Assistance Program. It is, we're fortunate this year New Hampshire is going to be eligible for up to $20 million to spend under this program, continuing to work on identifying communities that may qualify for funding. And as I said, we'll be sharing information this afternoon. We're going to be hosting a 1-hour information session on August 29th. And that's going to be hosted via Teams to allow for more opportunities for folks to be able to attend. Again, I'll put some links in the chat there where you can find additional information about that upcoming opportunity. And then lastly, just letters of intent relative to hazard mitigation, just continuing to encourage communities to be working to identify project scoping or physical construction projects or anything else mitigation related that you're interested in potentially pursuing for funding through the hazard mitigation program. We accept letters of intent on a rolling basis. We have several application periods currently open due to the number of public assistance disasters we have. So again, would just encourage you to be taking advantage of those opportunities that are out there now. And please reach out if you have any questions. And again, I'll throw in a link to where you can find information on how to pursue letters of intent relative to that program. That's all I got, Director.
Thank you, Austin. Deb Yeager, Community Services.
Good afternoon, everyone. I'll start out this afternoon with a little bit about schools. We have recently had 2 very large active threat exercises that went very well. Part of the reason they went so well is because the first responder community was at the table. So we had participation from fire, from police, from EMS. And so if there is a exercise in your community, a tabletop exercise for schools, please get involved, because it's a partnership, and it should all be, we can all work together on school safety. So another thing about the school safety program is that the portal for schools to submit their annual submissions of the emergency operations plan is open. It's over the summer, and it's only been open for about a month. So we start off a little bit slow. So if you're talking to your schools, please remind them to submit their EOPs for the year. Maybe once school starts, it'll pick up a bit. The School Resource Officer Conference was held this week and apparently was very well received. A lot of good presenters, and you might want to keep an eye open for it for next year if you'd like to go to that. It's the SRO conference. I can get you more information on that if you'd like. The next school task force meeting is going to be held on August 21st. And I think that's it for schools. There's also a program that Catherine Partington, our assistant chief, has been involved in, called Behavioral Threat Assessment and Management. Those classes are available in various forms, 1 day, 3 day. There's a 3 hour version of it. It can be done in different settings, such as healthcare organizations or schools, or any municipal organization. So I will put a one pager on that in the chat. Moving on to the stakeholder liaison group. We are getting out there as much as we possibly can. One of the things that has been very successful is the offering of fundamentals of emergency management, or as we like to call it, EMD 101. There is a class scheduled in Bartlett on October 1st. If you go to our training resource center, you will see the dates and you can sign up for those classes. If you would like to host one in your community, please reach out to your stakeholder liaison and we will get that started for you. We like to have it in places that will host it and then open it up to surrounding communities so that we can get as many people as possible to attend. We are also offering on an ongoing basis the Web EOC training. That's virtual or in person. So the next virtual class is on September 10th, and that too can be found on our training resource center. I have a new map for stakeholder liaisons. As you know, we've had some transitions of staffing, and we try to keep the map up to date. I will send that out to you, but just know that it's a living document. We have openings for part-time stakeholder liaisons. So if you're interested or know anyone who's interested, please have them check out the state jobs board. First responders, local first responders make great stakeholder liaisons. So think about that. Those of you who are just starting out or have part-time jobs or are retired, this is a cool opportunity for you to stay involved or get involved. And I think that's all I have for today, Director.
Thank you, Deb. So let's see, Vanessa, I'm going to ask you to open it up for questions before we get into our presenter and provide that opportunity. So Vanessa, the call is yours.
Thank you, sir. Marilyn Burkowski is on from the IAC. I believe she was
Okay.
ready to brief out as well.
Okay. Marilyn, why don't you go ahead then? I didn't see you on the list. Thank you.
I'll just keep it very short, sir, so you guys can move into the questions and presentation. Just wanted to highlight some resources that are available via products if you wanted to get onto our dissemination list. So I'm just pasting some links in here for public unclassified. Anybody could grab on to these. One of the major ones being that active shooter incidents summary that the FBI recently published looking at 2023. Another is this resource from CISA, the DHS entity, Cyber Infrastructure Security Agency, that looks at resources for onboarding new employees. We all have new employees coming on board. That's a great resource for folks. And one of my favorite resources for the first responder community, the ODNI NCTC First Responder Toolbox set. They recently published this Emerging Technologies and Possible Malign Uses by Terrorists. Great resource for the group. If anybody's interested in getting on the distribution list for the NIAC itself, please email our inbox. I just pasted the link there in the post. Thank you.
Thank you very much, Marilyn. Vanessa, you can go ahead for questions now.
Good afternoon, everyone. If you are on the phone, it is *5 to raise your hand and *6 to unmute yourself. If you are in the Teams app, if you raise your hand, we will come and find you and give you the ability to unmute. I'm not seeing anything, sir.
Okay, thank you, Vanessa. Okay, it's my privilege now to introduce Paul Mayo. Paul is the American Red Cross Disaster Program Manager for Southern New Hampshire. He's going to discuss some of the resources available to local communities and talk about building a stronger network for disaster response. So, Paul, I'm going to turn the call over to you, and thank you for joining us today.
Thank you. Welcome, everybody. Thank you for having us. I'm going to put my contact info in the chat here. Yes, so I'm Paul Mayo. I'm the Disaster Program Manager for Southern New Hampshire, for the American Red Cross. Sharing my screen. I don't know if someone confirm that you can see that?
Yep, we can see it, Paul.
Great. So the way we define Southern and Northern New Hampshire, and on the call also is Sarah Beaudry, who's the Disaster Program Manager for Northern New Hampshire. I'm not sure if Norm Gentry, who's my volunteer partner, is on. He lives in, I live in Lyme, New Hampshire. Norm lives in Manchester. And Sarah also has a volunteer partner, and his name is Irv Connery for Northern New Hampshire. The way we define it is the four northernmost counties, Coos, Grafton, Carroll, and Belknap, are Northern New Hampshire, and then the six southern counties are Southern New Hampshire. And basically, we all work collaboratively together. My boss, his name is Charles Hall. Some of you may know him. He's now the Senior Disaster Program Manager for the region, and our region covers Vermont, New Hampshire, and Maine. And then he reports to John Montez, who some of you may know, who's the Regional Disaster Officer, who then reports to Aaron McIntyre, who some of you may know, who in the recent past was fire chief in Concord. So I thought I'd just quickly cover sort of what the Red Cross does, our structure, and then just go over some shelter fundamental stuff. If anyone has any questions, I'm happy to answer them whenever. So at a very high level, the Red Cross sort of has three buckets that we put ourselves into, if you will. We have the biomed side, so blood services, which blood donations, which many people know. We have the training side, so CPR and things like that. And then we have our humanitarian side, which our sort of corner of that is we call disaster cycle services. The cycle part is because we're before, during, and after the disaster, not just after. Just a quick synopsis of the way the Red Cross is broken down. As I said, in the upper right corner, the pink is our region. So most of the people you'll deal with, either Sarah, myself, Norm, or Irv, or Charles or John, are covering New Hampshire and/or the region in certain capacities, and then the Red Cross itself breaks itself down into divisions. So our region is part of the Northeast Division, including New York and Pennsylvania. The reason why that's sort of important to know is the way we end up responding to disasters is we start at the regional level or the state, and then we work our way up to the divisional level. If the division can't handle it, then we'll start pulling in national resources. And so I thought I would just make a quick presentation about shelters. Just to start, you can always find out which of our shelters are open on our website, and that will give you information about where they are and different information to if anyone's ever asking you where's the closest shelter, that's probably the easiest way to do it. So sheltering. So the first thing I'd like to do, if I can, is just to differentiate between what we might call a center or facility or versus a shelter. So a cooling center, a warming center, evacuation center. The phrase that you'll hear with the Red Cross is a shelter is heads to beds. Something that's people are going to be sleeping in overnight. We often see in New England, one of the interesting things about New England is we're a pretty tough population. It's very difficult, as many of you know, to to get people to leave their homes unless they're in a pretty dire situation. Very often having a warming center where people can charge their phones or come in and get something to eat is all people are really looking for. And then you can obviously differentiate between an evacuation center, shelter, which is happening prior to or post impact shelter happening after the hazards already impacted the area. So why do we open a shelter? Basically, it's all hazards for any reason. Flooding, we just had several shelters open in Vermont for the flooding, which happened on July 10th, exactly 1 year after the flooding had happened in 2023 in Vermont. We had some shelters open recently in New Hampshire for some of the ice and snowstorms we had this winter. And then often, but it depends on the situation. Again, after a large multi-unit fire, we're happy to also open a shelter. So as I just said, most New Englanders are self-sustainable. They have wood stoves or some other means to heat themselves, depending on where they are located. And these are just some of the sort of planning assumptions that we normally use in thinking about who's going to show up, and then what is the capacity needed, including where parking, pets are fundamental. People are not going to leave without their pets, and then what other needs, functional medical needs, might they have? Our philosophy, number one, is we're looking to accommodate the broadest range of needs in our communities. We basically welcome anybody, and we want to make sure that it's accessible to people that have access needs or other medical needs, and then basically we ask the people to try to be proactive in their own recovery, because often we see that people who are displaced or they're unhoused pre-disaster, they have difficulty finding a place to go afterwards, and so that we work with the state and with the local partners and with other nonprofits to try to figure out great solutions for them. So we're not just simply closing the door and going home. So key word is partnership. So we partner with local governments. So that's all of you to basically come up with a plan, and we essentially we're looking for you to drive the bus, if you will, to have you identify what are your primary and your secondary shelter locations. We're emphasizing that one of them should be not a school, because we often see the disaster comes through, the school is able to open but not function as they want to, because other people in the community still need shelter resources, and so there's that disruption there. So if there's some other location that you can identify, then that helps. And essentially, as I said earlier, in a major disaster where there's widespread damage, we're probably going to be pulling resources from outside the region, looking to the division. Maybe people can drive. Are the roads open? If we're looking nationally, then we're looking, are the airports open? What's the weather? There may be a delay of 3 to 5 days, depending on whether it was an event that everyone had anticipated, or was this something that was sudden and unexpected. So were we able to pre-position resources and people? and then just the larger transportation questions that everyone would have. What are the roads open and so forth. The key part is that we also, depending on the size of the event, is whether you're contacting us directly and we're coordinating with the local partner, or whether we'll be asking you to coordinate through the state EOC if it's open and operating. And so that process is slightly different. So we try to identify 3 different types of shelter. The first one is managed by the American Red Cross. We can staff it by ourselves or with local partners if you have a CERT, which would be a great resource. And we supply the material. We can have a Red Cross supported or partner supported facility where basically there's some more of a balanced agreement where, depending on if you need our material, if you may have cots, you may need staff, we can figure those things out hopefully in advance. Or then the third part is just purely independent. And then again, we are happy to provide resources if we have them. But again, it may depend on the situation and what we're able to do. So a lot of these decisions are hopefully made in your emergency operation plans, and our staff is happy to sit on those meetings and discuss when what makes sense for you and how we can best support you. So as I said before, what happens before a shelter opens? Hopefully those shelters are identified in your EOP. We are hopefully engaging in that planning with you and with the state, and thinking about what are your needs. Having a shelter survey done, if it hasn't been done in several years, we can update those. Say your school didn't have a generator, now it does, that can be updated. And then make sure that if it's being staffed at all by the town or the city, that we're happy to try to organize shelter trainings with your community to try to make sure that you can stand up a shelter if you're isolated, for example, for the first, say, 72 hours. As I said, the shelter surveys, we try to update them depending on as they're needed, or periodically, to make sure that contact information is correct. And basically, it's a collaborative process to make sure that all of the different features are noted, and that there's enough capacity for, say, showering and bathrooms and all those type of things, depending on, again, what your community and demographics are. This may not be completely accurate, but this gives you just a general sense recently as to what the sort of breakdown is within New Hampshire. And it's a pretty good mix of different ways of doing it, and we're happy to help, as I said, in any one of those 3 ways. So how do you get shelters open? Basically, this number that I have here in red, and I will throw into the chat we have a presentation which describes some of what we do in more what we would call blue skies days, where we are responding to, say, home fires and so forth. This 833-583-3111, that's only for local and state officials, say EMDs, fire officers, police departments. That is basically the way our system is set up. Is basically that's our 911 number. You call that number, it bypasses the tree, There's an extra dash here in this 800 Red Cross. Anyone can call 1-800 Red Cross, or you, in theory, you could call your disaster program manager. As I said, it's either probably me or Sarah. But the 3111 number goes to our national call center, which is open 24/7. Just like 911, they'll pick up the phone, they'll figure out the contact info, what the situation is, and then they pass it to the region, which is essentially our dispatch center. We always have a duty officer on call 24/7 with several layers of backup. So someone will pick up the phone and call you back at some point. If, as I said earlier in this talk, that it's a larger event, so it's a geographically wide event, for example, the entire state or large part of the state, and the state EOC is open, then we would ask for the local EMD to process their requests through a web EOC, and then that request would be triage, if you will, to figure out what makes the most sense, whether we're opening a regional shelter or there's some other solution like a warming center or a cooling center, as I mentioned. When do shelters get opened? Again, that there's a big question mark as to whether they actually are needed. With New Englanders being pretty hardy. And so these are just some different questions that you could ask yourself. We do note here that it's easier to demobilize than ramp up. I would also note that it's sometimes easier to not mobilize if it's not needed, than to open a shelter and have a handful of people that have no solutions. Maybe there's a more direct solution for them with a hotel or some other arrangement that might be more of a permanent or longer term solution than a shelter, which we're hoping to open just for a few days. How are these shelter openings communicated to the public? I showed you at the very beginning on our Red Cross website. Anyone can always visit that. Our emergency mobile app contains the same information. We put out press releases. We depend largely on the state, county, and local governments to also put out information on your town web pages, on Facebook, using different social medias, and obviously emergency broadcasts if it's needed. This is just a glimpse of sort of in general where our shelter trailers are located in New Hampshire. Depending on what's happening, they may not be where those red dots are. I'm pretty sure a few of those are up in the Barry, Montpelier area right now, being restocked, and then they'll be back down. But we can pull resources again from Vermont, from Maine, from Massachusetts, and other locations as needed. And then this is just a quick look again at what every shelter trailer includes, trying to have it pre-organized to meet all the basic needs, and the different types of trailers that we have around the region, and how a shelter operation is thought through. They're not rocket science, as everyone knows, but to do them well, they need to be well thought through, and the space needs to be appropriately. You're able to appropriately assign different areas to different needs, to make sure that it's sustainable for the time needed. With shelter feeding, there's several different ways to do it. We just had a wonderful relationship that we had with the Southern Baptists in Vermont, where they have a mobile kitchen where they're able to put out hundreds of meals per day, and that worked fabulously. They're obviously, if the school or whatever location has its own kitchen facility, that helps. Obviously, also if there's restaurants open or something else, there's ways to do it that way. But the only thing that we say not to do is we ask not to have homemade items simply because of the risk of having everyone get sick. Pet sheltering is near and dear to everyone's hearts. There's many different ways to do it. We don't accept pets in the human part of the shelter, but we are happy to have cohabitated or to have a community, to have the shelter, I guess co-located would be the better word, in the same facility, so people will bring their pets with them. And the shelter services that we went over before, as far as one thing I didn't touch on is casework, which is something that we do day in and day out for, say, single family or multifamily fires. If somebody, their house is they're either displaced, say, for 48 hours or more, we can offer them some modest financial assistance, and then other services for recovery, mental health, health services, or spiritual care. And those things we also offer within shelters to make sure that people are headed in the right direction. And then, as I sort of touched on earlier, one of the big questions before opening a shelter is how do you close it, and just make sure that that the people that do not have a place to go have a plan in place, and then it's all wrapped up and everyone is happy at the end that whatever damage, and hopefully there's no damage, is being attributed and taken care of. And as I said, we're happy to offer shelter trainings for your local communities, and on everything from food safety to doing an exercise or preparedness type trainings. And so then I'll leave it at that. If there's any questions, I'd be happy to answer them.
Paul, thank you for that information. Vanessa, I'm going to ask you to open it up for questions specific to Paul's presentation and see if we have anybody out there with a question this afternoon.
Good afternoon, everyone. If you are on the phone, you can dial *5 to raise your hand and *6 to unmute yourself. If you're in the Teams app, you can raise your hand and we will come and find you and give you the ability to unmute.
I guess one question I would have is maybe we could do a show of hands is who has opened a shelter with the Red Cross. We have one. That's good. Or is that a question? That's one. Well, if you don't have an agreement with us, and again, as I said, where there's a process in place, and we're happy to chat with you and to see how we can help.
Director, I'm
Paul,
not seeing anything beyond that for questions.
Okay. Paul, thank you for taking the time to meet with us today. We appreciate your presentation. Folks, if there's no further questions, this is going to bring the call to a close today. Just a reminder, our next call will be September 19th. So please, if you have a need, please feel reach out to us in the meantime, and we look forward to seeing everybody in September. Thank you.